And the city of Daegu is currently recovering from this status. And as for the high-risk groups, including the Shincheonji members who have symptoms, are almost completed, and we are expanding our screening process to the regular citizens of Daegu. And the doctors in the city are also assessing and evaluating the severity of their levels, and we are managing so that those with the severe symptoms could be hospitalized at first. And those who are staying at home, we are also having via phone consultations with the medical staff. As for these mild symptom cases, we are expanding the beds at the live treatment centers so that the more beds could be emptied to accommodate those with more severe symptoms. And as of yesterday, the HR Center and the Nonghyup HR Center and the Samsung HR Center have opened their doors. And today we have the Hanti House in Chilgok, which has also opened its doors. And there will be more live treatment centers that will open their doors. And the one including the Chungpung Resort, LG Display HR Center, as well as the Post Office HR centers will also open their doors simultaneously within the next 3 to 4 days. And by the end of this week, 2,000 more patients will be accommodated at these live centers, and we will spare no efforts in providing them with more personnel and supplies. I thank all of the local governments, public institutions, and the companies for providing such facilities. And I also thank all of the related staff who are engaged in the whole process. And in order to treat these patients, we are increasing the number of hospital beds. On top of the existing beds, we have completed the construction at the Daegu Military Hospital. It is equipped with 303 hospital beds and has negative pressure units, and it will be accommodating patients with higher severity. And we will also provide sanitary aids as well as the guard suits for the people who are working at the site, including the masks and goggles as well. And as explained above, this was the summary of how things are progressing in the Daegu city, and the outcome will be alleviated in the near future. And as for Gyeongbuk, Gyeongsan, we have added this region as a special region for countermeasures. As of the 4th of March, the area's outbreak is accommodating more than 40% of all of the outbreak within the region. And this city is also near Daegu City, meaning that the members of Shincheonji, half of these members actually live in the city of Gyeongsan. And we are worried and concerned of the community transmissions, which are already being witnessed in this city. So therefore, within this city, we need to curb this further spread of the virus. And we need to curb further spread of the virus into other regions, and this is why it has been designated as a special area. Among the Shincheonji followers, the case number 31 has more than 500 contacts, and all of them have been on self-quarantine. And about 240 trainees of Shincheonji Church has also put on quarantine. And we also linked and cooperated with other screening institutions to facilitate the screening process. And aside from the 3 screening facilities that we have, we will increase upon the needs more screening facilities so that they can accommodate to the needs in the city. And In the Gyeongsan City, we have the SME Research Center, which will be also be turned into a life treatment center upon needs, and we will provide supplies and logistics to help the facilitation of the treatments. And as for the city of Gyeongsan, although it is not witnessing a large number of outbreaks, it is steadily increasing, and this is why we need to curb and control the situation as soon as possible. We need to identify as soon as possible initial stages of cases so that we need to control the virus and curb the further spread of the virus within the community and the region. I also ask for all of your support, especially for those who are living in Gyeongsan City. Please do help us out, and we ask you to refrain from going outdoors. And if you have chronic illnesses or if you are elderly citizens, please do refrain from going outside to crowded places. Next, we will explain to you about the public medical staff who have been newly accommodated today. A total of 722 people have been accommodated and designated as newly public medical staff so that they could facilitate the process of treatment. They will be stationed in parts of the country to help out the quarantine measures, including the epidemiological surveys. Especially in Daegu and Gyeongbu, we have designated and dispatched 320 in Daegu and 150 in the Gyeongbu province. And the rest of the medical staff will be designated to other regions depending on the population ratio. And in order to prevent them from fatigue and further infection, we also will provide them with a 2-week paid leave so that they could protect themselves from further infections. And we will provide as many as supply goggles or masks that are needed. We will also provide them with allowances and benefits, and we will also provide accommodations and transportation for these people so that they have no inconvenience within their work. And the government has and is still supporting Daegu and Gyeongbu region with medical staff, and we have been dispatching over 280 doctors to the region, as well as nurses to the Daegu city. And yesterday, we have 75 new nurse officers who graduated the Korea Armed Forces Nursing Academy, and they have been dispatched to the Daegu Military Hospital, who will begin work from tomorrow. I extend my deepest gratitude to all of the medical staff who are exerting their full efforts to curb the disease on the sites. And as for the accommodation and the recruiting of more medical doctors, we hope that we could find more doctors in the upcoming time. And next is about the Shincheonji members. From Shincheonji, we have received a list of members, and certain local governments have raised the issue of credibility of this list. Therefore, as of 11 a.m. today, we have begun the administrative surveys and investigation into the headquarters of Shincheonji, located in Gwacheon City. We have dispatched forensic investigators so that they could investigate on the site, and this will be subject to the list of the members of the Shincheonji as well as the trainees, and the number of participants at their surveys, so that we can enhance the credibility of the list. And this is a data which will help us identify the movements and the travels of these individual members. We will provide you with latest updates if we have received them from the site. As we see an increase in the number of infections, further infections among children and toddlers, we will expand the holidays for the nursery schools and kindergartens and schools to 22nd of March. We also have the urgent care services which will be provided to any households that are needed. And if you have any inconveniences, please do report to the ministry, and we will carry out inspection on that specific facilities. And also the social facilities that also have been closed will also expand their closure until the 22nd of March. We believe that social distancing is of utmost importance in order to curb the distance, and this is why we have decided the following measures. We apologize for the inconveniences caused by such measures. However, we hope that these inconveniences are aimed at alleviating further inconveniences that could be possible in the near future. The central government is currently working closely with local governments in order to curb the disease, and we also thank all of the public for your participation and coordination. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석하신 분들은 단상.
There you have it. That was Central Disaster and Safety Countermeasure Headquarters on the latest outbreak of the coronavirus here in the nation. South Korea has confirmed, just to recap for some of the information that we just heard, that the country has now a total of 5,766 confirmed coronavirus cases in the nation, with the death toll standing at 36. The South Korean government also said that it has designated the city of Gyeongsan of Gyeongsangbuk-do province as a special management region, the third such kind following the metropolitan city of Daegu and Cheongdo. Now that means that the city of Gyeongsan has seen a hefty amount of coronavirus infected cases there, requiring some special need of the government. That does it for us at this hour, but we'll be back with more of the latest on the coronavirus outbreak and much more coming up at noon Korea time, which will be less than 1 hour from now. Thank you for watching, and goodbye for now.
The novel coronaviruses are spreading all over the world. To prevent the virus from spreading further, it's essential to attend to personal hygiene and take preventive measures. Rule number 1 for preventing the infection. Wash your hands thoroughly in running water with soap for at least 30 seconds. Rule number 2, wear a mask. If you have respiratory symptoms such as cough, make sure to wear a mask when visiting medical centers or going outside. When coughing, cover your mouth and nose with a sleeve, not with your hands. If you develop symptoms such as a fever, cough, or sore throat, call your local public health center, the Disease Control Center at 1339, or dial your area code +120.
When it comes to controlling an infectious disease, we all have an important role to play, so please practice